In today's Eye on Health, it is something that hundreds of thousands of moms go through, and yet very few actually get treatment for it. Some just chalk it up to the baby blues.
Well, postpartum depression and anxiety are more than just baby blues, and a new center in Pittsburgh at West Penn Hospital is not only helping women cope, they're also using some star power to fight the stigma around maternal mental health.
Nobody prepared me for the possibility of postpartum.
Yeah. I mean, it's just not talked about.
It doesn't come up like, do you think that this is a possibility? You know, you're experiencing a lot of anxiety.
This moment on the green sofa was a milestone moment for Ashley Griffin, not because she got to meet model and TV personality Chrissy Teigen, but because she was finally able to publicly open up about her struggle with postpartum depression.
I'd had this notion in my head that only one of us was coming out of the delivery room.
That intrusive thought began while Ashley was pregnant and only became more powerful after her son Grayson was born.
I was pulling away from him, and I had started to just kind of think like, maybe I just shouldn't be here. Maybe, you know, he would be better without me there.
Ashley told me it was hard enough to say that out loud, but when her doctor recommended she go to the nearest clinic immediately for help, she was turned away.
And I said, you know, I think I have postpartum depression. I want to kill myself. And she doesn't even look up at me, asked me who I have for insurance, and said they didn't take it. So she said, sorry, we can't help you.
A devastating blow as she reached out for help. But it was then that Ashley's sister-in-law got her in contact with Dr. Sarah Himitsky of AHN's Alexis Joy Diachille Center for Perinatal Mental Health. Dr. Himitsky stayed late that day, waiting for Ashley, who lives in Ohio.
It takes an incredible amount of strength, I think, to set foot in this center, regardless of how beautiful it is, because of the stigma.
Ashley's story is just one of many. Last year, 500,000 women were diagnosed with postpartum depression. Only 15% seek help. The center itself is named after Alexis Joy Diachille, who took her own life just 6 weeks after the birth of her daughter.
There's so much stigma around postpartum depression, postpartum anxiety, a lot of feelings that if you are depressed and not happy, that you aren't cut out to be a mom.
Chrissy Teigen, who suffered with postpartum depression, decided she wanted to be part of the solution to end the stigma associated with maternal mental health. In March, she toured the center and met several women who put words to the thoughts and feelings that so many mothers experience.
Chrissy,
This is real life.
Heather, you in my living room.
It's all part of a campaign called My Wish for Moms. Mothers are encouraged to join the cause on social media and share their stories with the hashtag #MyWishForMoms, creating an army of support.
You feel like you're drowning.
Yeah, you really do.
For a really long time, I felt like this is just the baby blues. Pull yourself together, Heather.
It's hard to admit that you're struggling when everyone tells you this is supposed to be the happiest time in your life.
For Ashley, the support and help came from Dr. Himitsky and an intensive outpatient program that she attended 3 days a week with Grayson.
The best parts of the center is the ability to bring your baby with you.
With supplies readily available like diapers, rocking chairs, a kitchen even, the center is fully equipped, allowing mom and baby to relax while working on coping skills.
It really made me see that my postpartum depression wasn't something to be ashamed about. It happens to, it can happen to any woman. I regret missing out on that time, but I'm just thankful that I'm here now. Like, that is, to me, that's the most important thing.
Wow, what an important message. And I'm so glad you did this story, because you are going to help moms by letting them know what they're doing over there.
They do such amazing work. A lot of the women appreciate the group therapy because I think it's just knowing you're not in this alone, that so many other women are experiencing it. It's not just first-time moms. It can be if this is your third child, your fifth child. I mean, and it can start while you're pregnant. So it's important to recognize some of those signs and symptoms. Some of the coping mechanisms, Dr. Himitsky said they use a lot of temperature therapy. So if you're really worked up, and this could work for anybody, if you're really stressed one day or in an argument or something along those lines, you can go to your freezer and take ice cubes and put them in your hands. And she said just holding them in your hands will calm your brain and tell your heart to slow down. So even coping mechanisms like that the women can use at home if they do find themselves in panic or anxiety. It's something like that. So doctors say if you are experiencing hopelessness or sadness that lasts longer than 2 weeks, it is more than just baby blues. They want you to get in contact with them. And for a link to the intensive outpatient program and the Center for Perinatal Mental Health, go to pittsburghtodaylive.com.
Yeah, and keep watching for our Eye on Health series here on PTL. It is every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network.